if you look at the Tagarira floods, the Tagarika floods, and compare with what we have in Mbare, they are all in Mbare. But if you look at the life of those people staying in Tagarika floods, it's better than in some of those floods we are also talking about. So if we are to work on the densification of the floods in that Mbare, about 8 or 10 floors, I'm sure the city of Harare will also need to work on the pressure for water, because there is no way you can go up using a bucket. You have to work on the pressure of the water and other things. And I'm sure under the Mbare redevelopment program, those are the issues which are there.
Now, Victor, we have been talking a lot about how Mbare is overcrowded and whatnot. And like I said, these are some of the issues that they have said have led to the infestation of bedbugs. What is your assessment of the current situation in Mbare in regards to the bedbugs? How bad is it and how detrimental is it to people's health?
Thank you very much. Yeah, the situation is dire, let me say that. When it was recognized or identified that there is an outbreak of bedbugs, the people had no knowledge. And remember, these people have been using chemicals to kill the bedbugs. But because of lack of knowledge, it wasn't done methodically. And probably let's look at why. Our flats are overcrowded. And there is a lot of traveling and a lot of selling that happens in Mbare. And if you look at the predisposing factors, mostly it's overcrowding. And yes, Sidingomo talked of overcrowding. And you know that what we say, our minimum standards are that a person, not couples, should occupy at least 4 square meters. If 2 people that are not a couple occupy 4 square meters, then the room is overcrowded. Yeah, because unless you're a couple, so you need 4 square meters in your only room if you're not married. And for Mbare, I think you know what it means. There is gross overcrowding, and there is cluttering. Properties overcrowded, and even space to spray. It's very, very difficult. So when we heard about the outbreak, then we took a census of how many flats are affected. And then we tried to mobilize resources with the Harare City. And we also included other stakeholders. That include the civil protection.